Gentlemen, my name is Dr. Canbilen, and today I'm presenting my paper titled Subcutaneous Barbed Suture as an Adjunct to Staple Closure Reduces Postoperative Wound Ooze in Total Knee Arthroplasty. Prolonged wound ooze is associated with surgical site infection and prolonged hospital admission. There is an association between superficial wound infections and prosthetic joint infections. Tissue adhesive and barbed suture has been shown to reduce wound ooze in total hip arthroplasties. However, no study has looked at the use of these adhesives or barbed suture as adjuncts to staple closure in total knee replacements. We had a group of 69 elective total knee replacement patients who were operated on by the same senior surgeon. They received the same pre, peri and post-operative care and received perioperative antibiotics and VT prophylaxis as per departmental policy. The three groups that analysed were those that had stapled own closure, staples and wound adhesive, staples and subcutaneous barbed suture. Data on wound ooze was collected prospectively by a blinded single observer. There was daily assessment of wound ooze using a clear film template as shown in figure 1 to the right. The decision to change the dressing was made using trust protocols, and patients were only discharged once wounds were dry. Going to the patient demographics, there was no significant difference in sex, age, type of surgery or comorbidities. However, the barbed suture group was found to have a higher BMI on average and lower ASA grade. The outcomes, so the barbed suture group had fewer dressing changes on day 1 and day 2, had shorter hospital stay, 3 days versus 4 days of the adhesive and staples group, had a lower median total number of dressing changes, and had lower rates of prolonged wound ooze compared to the adhesive and staples group. These are graphs showing that the barbed suture group had fewer number of dressing changes, shorter hospital stay, and lower rates of prolonged wound ooze. Demographic profiles were well matched in the study except for BMI and ASA grade, which were found to be statistically significantly different. However, a paper by Wood et al. Looking at postoperative wound ooze in arthroplasty showed that it was lower BMI that was associated with reduced wound ooze, and that difference in ASA had no significant effect. We propose that absorption of tensile forces by the barbed suture during knee flexion in the post-operative rehabilitation period might go away in explaining as to why there is reduced wound ooze. In conclusion, the subcutaneous barbed suture as an adjunct to staples is associated with reduced total number of wound dressing changes, reduced risk of prolonged wound ooze, a shorter hospital stay, and a calculating saving of at least £233 per patient in our trust. However, this study does highlight the need for randomised controlled trials, given the retrospective nature of this study, and larger patient groups. Furthermore, a validated technique of measuring wound ooze would be required. Therefore, based upon these results, we propose the use of barbed sutures as an adjunct to staples for closure in total knee arthroplasty. Thank you for listening.